That's right, guys, you guessed it. We're talking about the fastest thing spreading around the globe, coronavirus. Welcome back. Come in. Just don't get too close. Make sure you guys stay about 3 feet apart. Cover your coughs and sneezes. Don't breathe on your neighbor, all that stuff. But come in. All right, guys, you guessed it. We're talking about coronavirus. This thing is crazy. It's got the world in an uproar. We are in a global pandemic. The United States is in a national state of emergency, and this thing is just going by the hour. I mean, information is coming in left and right. Cases keep popping up. Deaths keep popping up. So we're just going to talk about a little bit of this. I kind of wanted to document this event because this is unprecedented. We've never seen stuff like this before. So without further ado, let's just hop right into the video. All right, guys, now I wasn't one to get all hyped up about the coronavirus and the spread of it. You know, I kind of really started paying attention to it in about the end of January and February, kind of when we first had the first case here in the US, and just going back and looking at what was happening in Wuhan, China in December and January, just kind of getting a feel for this whole thing. I kind of was intrigued and have really kind of been following it since. I wasn't really getting freaked out and paranoid and nervous and all that. For the most part, in pretty good health and don't really get the flu that often anyway. I do a pretty good job of trying to fight that naturally every year. Sometimes I win, sometimes I don't, but overall in pretty good health. I wasn't really paranoid and freaked out about this whole thing. What really became alarming to me was, as a sports fan, when they started doing weird things with the sports, like they were going to continue games with no fans, whether it was college basketball with the conference tournaments coming up and March Madness on the horizon, NBA, you name it. I mean, all these different sports leagues around the country, from really the professional level all the way down to the high school level, were starting to pitch the idea of playing games without fans. It really kind of surprised me. That was something I've never really seen in my time. And I believe that same day, and this was only about 3 or 4 days ago, the same day is when I really started to pay attention to what was going on in Italy. And they went on the national lockdown, quarantine, and it was just surprising watching their cases rise and their deaths rise. And it's still, to this day, as I'm recording this, and that was 3 or 4 days ago, today they've had the highest death toll. So that's still growing and popping up over there. Now that it's come into the US, I'm certain that we're not far behind them. I think as you follow the trend of coming from China and across the globe, it's inevitable that we are going to be in the same predicament as these other countries if we don't do something, if we don't shut this thing down, lock down, quarantine. I know everybody has different opinions on it, but I really think at this point that that's the fastest way to stop the spread of the coronavirus, or COVID-19 as it's referred to. And then right about the same time, a few days ago, I'd say about 5 days ago, is when people in the United States just started going crazy over toilet paper. Now, there's all sorts of reasons why people are scrambling for toilet paper. I'm not going to get into that. However, I have not been bulk buying things. That's just my own personal choice. I believe if supplies are limited, we first need to get those to the people that need them most. And in this case, it's the elderly and people with pre-existing conditions, autoimmune diseases, deficiencies, things like that. So I'm not out there bulk buying and doing that sort of thing. Shame on you if you are, and if you are and you can help somebody in need, please do the right thing and help your neighbors, help your family, help your friends. So then the next day rolls around, and I'm talking maybe 2-3 days ago, the president announced that we are in a national emergency, and now you start seeing states kind of make their own decisions on what they're doing. Public schools are closing down, not allowing students in there for 2 to 3 weeks to 30 days, just kind of depends on the state and the area. In the state that I'm in, that really hasn't happened yet, but as of today, surrounding states are starting to close bars and restaurants, or giving a 50% capacity limit, and really trying to eliminate people gathering in large groups. Now, that's what we're calling social distancing, right? So we're trying to limit the amount of people in public areas areas, gathering, bars, restaurants, events, all these things. We want to try to keep people in their house, away from sick people. If you're sick, you're supposed to stay home, you're supposed to not go to work, all that stuff. So it's really important to really conquer this thing that we take heed to those things, stay home, practice good hygiene, wash your hands, cover your coughs, sneezes, all that stuff. I believe really if we go to this national quarantine or something to the effect of where you're not going to be able to leave your house, I think that's where we're headed, and I think that's probably the best solution for something like this at this time. As of today, I just checked a little while ago, we have reached over 6,000 deaths globally, and I believe there is about 162,000 cases, just shy of 163,000 active cases open. In the state that I'm in, we currently have 18 active cases, no deaths. 17 of those cases can be traced back to a cruise line or some type of travel. The last case that came out last night, which was the 18th case, was determined to be community spread. So that's a little bit different, and we're going to have to keep an eye on that, at least in my state, of how that is going to start affecting the spread, and just kind of see what unfolds over the next couple days, where these cases might be popping up and what our state officials are going to decide to do outside of what's mandated by the federal government. All right, guys, so that's pretty much what's going on. It's kind of crazy. Things are always changing and always evolving. Every hour there's something new. Governors and mayors all across the country are going live with press conferences, even over this weekend, Saturday and Sunday. So things are always changing, and I'm definitely planning on being back with another kind of update. Sure, if I wait a day, 2 days, 3 days, things could drastically change, because from where we were at last week at this time to where we are now is two completely different spaces. If you were to ask me 7 days ago, do I harness or hold these same thoughts about this whole thing as I do now, I would have told you no. I would have told you, yeah, that I just thought that if, you know, people are diligent, washing their hands, you know, doing all those hygiene things during flu season and things that you're supposed to do anyway, that it shouldn't be a problem. Well, this thing is spreading rapidly, and it's gotten crazy. So things are changing all the time. I'm not sure what the next video will bring, but I'm certainly going to document it. I think it'll be cool for others to see, as well as just something as a time capsule of what's going on right now. So appreciate all you guys watching. If you made it through this video, make sure you practice all the safe things they're telling you from the CDC, from the government, your health officials, all those things. Practice good hygiene, stay away from people if you can, all those things. Practice that stuff, and hopefully we can beat this thing and really get some good part of 2020, because it has not started off good for a lot of people around the world. So that's all I got for you guys. I really appreciate you guys watching. Don't forget to click that like button down below, hit that subscribe button, and definitely turn on those post notifications. That way you'll stay up to date with all these Never Ending Quest videos. Thanks again, guys, for watching, and we'll see you when we're all quarantined, I guess.
Hold up.